Welcome to Unit 1 of this module on follow-up and monitoring. In this unit, we will look at appropriate follow-up actions after treating an STI. By the end of this unit, you will be able to explain the need for follow-up to ensure successful treatment, summarize partner treatment recommendations, and follow-up of exposed infants. After treating an STI, it is important to follow up with some additional actions, including treatment of all sexual partners, observation, testing, and treatment of newborns who may have been exposed to STI or RTI during pregnancy. Follow-up visits are rarely needed to ensure that treatment was successful or test of cure. In most cases, women can be reassured that treatment is highly effective when taken correctly, and there is no need for special follow-up visit unless they continue to experience problems. Most questions and concerns can usually wait until the next routine ANC visit. One important exception is partner treatment, and this depends on the specific diagnosis. With definitive STI diagnoses, such as positive syphilis tests or gonorrhea culture, partner treatment should be strongly advised. It should be noted that the patient may have multiple sexual partners. The clinician should discuss this issue without judgment, stigma, or shame to ensure that all sexual partners receive testing and appropriate treatment. With probable diagnoses, such as cervicitis, based on clinical signs or microscopy, care should be taken in counseling couples, recognizing uncertainty in diagnosis while offering treatment to ensure a healthy pregnancy. Non-recurrent RTI usually does not require treatment of sexual partners. These differences in treatment and response are important. Partner treatment for STIs is needed to break the chain of infection. Yet insisting on partner treatment when not indicated or when a diagnosis is uncertain risks introducing misunderstanding, suspicion, and even violence within the couple. For example, a woman with vaginal discharge likely has an endogenous RTI unrelated to her or her partner's sexual activity. Treating her partner has no benefit and may lead to one partner accusing the other of infidelity. For this reason, careful counseling is essential. Often, even when partner treatment is indicated, the uncertainty of the diagnosis and unknown timing of any exposure should be emphasized. However, partner treatment is often readily accepted if offered as a precaution to ensure an uneventful pregnancy and a healthy newborn. Refer to Table 4.1 in the reading materials for this module for partner treatment recommendations by STI or RTI diagnosis. Follow-up, and in some cases treatment, may also be indicated for newborns exposed to STI during pregnancy, even when the mother was effectively treated. Let's look at this in more detail. For syphilis, you should refer to the protocol for newborn and infant follow-up. Infants born to mothers who had syphilis during pregnancy require evaluation and treatment to avoid complications of congenital syphilis. For women who may have had a primary HSV2 infection at the time of labor and childbirth, close follow-up of the newborn is indicated. For gonorrhea and chlamydia, follow-up may be indicated if the mother was not adequately treated or if ophthalmia neonatorum, or ON, prophylaxis was not given at the time of childbirth. You've now completed Unit 1 follow-up. In the next unit, we will look at monitoring STIs, RTIs, and AMR in pregnancy.